Hello, and welcome to The Healthy Way. I'm Dr. Stephan, and today we are talking about something that can literally save a life if you pay attention early. Colon cancer is one of the most common cancers, and what makes it especially dangerous is that it can start quietly. People often feel fine, they look fine, they keep working and living normally. And the warning signs can be subtle enough that they get brushed off as stress, diet, or getting older. But the truth is, the body usually whispers before it screams. The colon is part of the digestive system, and when something isn't right, the signs often show up in your daily bathroom habits, your energy, your appetite, your belly, and even your blood counts. This video is not meant to scare you. It's meant to wake you up because awareness is power, and early detection changes outcomes in a big way. The earlier a problem is found, the more options there are, and the better the chances of treatment working. Here's what I want you to understand first. The colon is not just a passive tube. It is living tissue. It responds to inflammation, to irritation, to the constant traffic of what you eat and how your body processes it. It also depends on hydration, movement, and a healthy balance of gut bacteria. When that balance is thrown off for a long time, problems can develop. Not always cancer, but issues that can progress if ignored. So today, we're going to talk about the signs people should be aware of. The kinds of changes that are not normal when they persist. The patterns that deserve attention. The symptoms that should never be waved away. And what you can do to reduce your risk and take care of your digestive health starting now. If you want more clear, real-world health education that you can actually use, subscribe to this channel. Share this video with someone you care about, and comment below if you've ever wondered whether something you're re-experiencing is normal or not. You might help someone else speak up and get checked. Now, let's get into it. One of the biggest signals that something may be wrong in the colon is a change in your bowel habits that does not resolve. I'm not talking about one odd day after a heavy meal. I'm talking about a noticeable shift that lasts for weeks. You used to go regularly, and now you're constipated most days. Or you used to be stable, and now you have frequent loose stools. Or you bounce between constipation and diarrhea in a way that feels new for you. Your baseline matters. The question isn't what's normal for someone else. The question is what's normal for you and what has changed. Constipation on its own does not mean colon cancer. But persistent constipation can be a sign of a bigger problem, especially when it comes with other symptoms. When stool stays in the colon longer, it becomes drier and harder to pass. That can lead to straining, discomfort, and irritation. It can also be a clue that your colon motility is slowed or that something is narrowing the pathway. Again, this doesn't automatically mean cancer. But if constipation is new, persistent, and especially if you notice thinner stools than usual, you should not ignore that. Now let's talk about blood, because this one matters. Blood in the stool is never something to casually accept. Sometimes it can come from hemorrhoids or fissures, but you do not want to guess. Blood can appear bright red, dark, or even make the stool look black and tarry. It can also be hidden, meaning you don't see it, but you slowly become anemic, tired, short of breath, weak, and pale. Unexplained anemia can be one of the ways colon issues show up. If you have rectal bleeding, if your stool is consistently dark, if you feel dizzy or unusually fatigued, or if you are losing weight without trying, those are red flags. That is not the time to self-diagnose. That is the time to get evaluated. I'm saying this with care because a lot of people delay out of embarrassment or fear. But the colon does not care about embarrassment. Your health deserves attention. Listening early can change everything. Another thing people should pay attention to is persistent abdominal discomfort that feels different than your usual digestion. This can look like cramping that comes and goes, a sense of pressure in the lower belly, a feeling of bloating that doesn't match what you ate, or the sensation that you need to go to the bathroom but can't fully empty. That last one is important, because many people describe it as incomplete evacuation. You go, but you still feel like something is left behind. When that becomes frequent, it's a sign that your colon is not functioning smoothly. Now, many benign conditions can cause bloating and cramping, including food intolerance, stress, irritable bowel patterns, and infections. But when symptoms persist, become progressively worse, or are combined with blood, weight loss, or fatigue, the priority is to rule out serious causes. Let's also talk about unexplained weight loss. If you are losing weight without trying, without changing diet or exercise, that should always be investigated. Weight loss can come from many things, including thyroid issues, stress, depression, or other illnesses. But it can also happen when the body is dealing with chronic disease that changes appetite, metabolism, or absorption. And don't ignore appetite changes. If you used to enjoy food and now you feel full quickly, or you're eating less because your stomach feels unsettled all the time, that is worth attention. Sometimes people brush this off as aging or being busy, but persistent digestive changes are not something you should normalize. Now let's talk about risk factors and habits in a responsible way. People often want a simple answer, like this one thing causes colon cancer. That's not how it works. Cancer risk is usually a combination of genetics, age, environment, inflammation, and lifestyle over time. Some people have higher risk because of family history, personal history of polyps, inflammatory bowel disease, or certain inherited syndromes. Others increase risk through patterns like long-term poor diet, low fiber intake, high intake of processed meats, high alcohol intake, smoking, and a sedentary lifestyle. But even then, it's not guaranteed. It's about risk, not destiny. One thing that does matter for colon health is regularity and stool quality. Staying hydrated supports softer stool and easier movement through the colon. When hydration is low, stool gets dry, constipation worsens, and irritation increases. Hydration alone doesn't prevent cancer, but it supports healthier bowel function and reduces strain. Movement matters too. Physical activity supports gut motility and improves circulation. Sitting for long periods can slow bowel movement and contribute to constipation. Again, it doesn't mean you will get cancer if you sit. But if you already have a tendency toward constipation, inactivity can make it worse. Another factor is your gut microbiome, the community of bacteria in your digestive tract. A balanced microbiome supports digestion and helps maintain the integrity of the gut lining. When the microbiome is disrupted for long periods, often through highly processed diets, frequent antibiotics, chronic stress, and poor sleep, inflammation can increase. I want to be clear, this is not about perfection. It's about direction. Your daily habits shape your internal environment. If your gut is constantly irritated, if bowel habits are consistently abnormal and you ignore it for years, you increase the chance that something progresses without being noticed. The most powerful habit is not a supplement or a cleanse. The most powerful habit is getting screened at the appropriate age and earlier. If you have risk factors or symptoms, screening finds polyps before they become cancer. That is prevention in real life. Let's talk about what people should do when they notice signs, because awareness without action doesn't protect you. If you have any red flag symptoms, persistent rectal bleeding, black stools, unexplained weight loss, persistent abdominal pain, ongoing change in bowel habits, or unexplained anemia, the right next step is to talk to a medical professional and request evaluation. That may include stool tests, blood work, imaging, or a colonoscopy based on your situation. A colonoscopy is not something to fear. It is a tool that can literally detect issues early and remove polyps before they become a larger problem. If you are someone who feels anxious about doctor visits, I want you to reframe it. Screening is not a sign that something is wrong. Screening is how you confirm things are right or catch them early if they aren't. Waiting until symptoms are severe is the opposite of strength. It's delay. Now, for people who do not have red flag symptoms but want to reduce risk, focus on consistency. Hydration, Daily movement and fiber-rich foods that your body tolerates can support regular bowel movements. Fiber helps stool move through the colon and supports beneficial bacteria. But fiber has to be introduced gradually and paired with water, or it can worsen constipation for some people. Also, pay attention to your personal triggers. Some people notice bloating and discomfort with certain foods. That doesn't mean those foods cause cancer, but chronic irritation is never helpful. If your digestion is constantly inflamed, it is worth adjusting your diet and improving digestion. Limit high-processed foods and processed meats as much as possible, not from fear, but from evidence that long-term patterns matter. Reduce alcohol if intake is frequent. And if you smoke, consider that one of the most powerful risk reductions you can make is quitting. I also want to mention sleep and stress because the gut is deeply connected to the nervous system. Chronic stress changes gut motility and inflammation. Supporting your nervous system through better sleep, breathing, and daily recovery can help your gut function. Now let's talk about a very common trap. People normalize constipation because it has become their normal. They say, "I've always been like this. I only go every few days. I strain, but it's fine. I'm used to it." I want you to understand that being used to something does not mean it is healthy. Regular bowel movements matter because the colon is designed to move waste out. When waste sits longer, it changes stool consistency and can increase irritation. It also often reflects a bigger pattern like dehydration, low fiber, low movement, or poor gut motility. If you are someone who goes in frequently, the goal is not to force aggressive solutions. The goal is to rebuild normal function. Start with water. Many people underestimate how much their body actually needs. Then movement. A simple daily walk can stimulate the gut. Then diet. Increase natural fiber in a way your body can tolerate and monitor how you feel. But here is the bigger issue. If constipation is new for you, or if it becomes progressively worse, or if it comes with pain, bleeding, or pencil-thin stool, do not treat it as a lifestyle issue only. Get it evaluated. It's better to be told everything looks fine than to assume fine and miss something important. Another symptom that people dismiss is gas and bloating that becomes chronic, especially if it arrives suddenly and stays. Gas can be diet-related, but persistent bloating, especially with appetite changes, weight loss, or fatigue, should be investigated. When it comes to colon health, the story is often written in patterns. Patterns over weeks, patterns over months, not a single day. So watch the patterns. I want to speak to the people with family history, because if colon cancer runs in your family, your timeline matters. Screening may need to happen earlier, may need more frequent follow-up. This is something you should discuss with your doctor so your plan is personalized. Family history does not mean you will get cancer, but it does mean you should take screening seriously and not delay. Also, age matters. Risk increases as people get older, but colon cancer can occur in younger adults as well. That's why symptoms matter at any age. If you are young and you have persistent bleeding or changes in bowel habits, don't let anyone dismiss you automatically. Advocate for yourself. Now, what does healthy colon support look like day to day? It looks like steady hydration, consistent movement, balanced meals, and paying attention to digestion. It looks like not living on ultra-processed foods. It looks like managing stress and protecting sleep. It looks like responding to symptoms early instead of waiting. It also looks like removing shame from digestive conversations. People avoid talking about bowel movements because it feels awkward. But your stool tells you about your hydration, your fiber intake, your digestion, and sometimes your health risks. This is not gross. This is medical reality. I want you to do something simple after this video. Think about your baseline. How often do you go? Has it changed? Do you ever see blood? Do you ever feel like you can't empty? Are you unusually tired? Have you lost weight without trying? If any of those are present and persistent, do not wait. Let's bring everything together. Colon cancer is common, But the most dangerous thing about it is not the colon itself. It's the delay. It's the time people lose by ignoring signs, normalizing symptoms, or hoping it will go away. Your body gives signals for a reason. Changes in bowel habits, persistent constipation or diarrhea, blood in the stool, dark stools, unexplained anemia, persistent abdominal pain, bloating that doesn't make sense, unexplained weight loss, and a feeling of incomplete bowel movements are all signs that deserve attention, especially when they persist. And the message is not panic. The message is action. Screening is one of the most powerful tools we have. It can find problems early and even prevent cancer by removing polyps before they become something worse. That is real prevention. On the daily lifestyle side, support your colon with hydration, movement, fiber that your body tolerates, fewer ultra-processed foods, and better recovery through sleep and stress reduction. These are not perfect fixes, but they are strong foundations for gut health. If you are watching this and you have symptoms, take this as your push to get evaluated. If you're watching this and you feel fine, take this as your reminder not to postpone screening when it's time. If you found this helpful, subscribe to The Healthy Way. Share this video with someone you care about and leave a comment below. Tell me what topic you want next: digestive health, inflammation, gut microbiome, or cancer prevention strategies. Your health is worth your attention, and the best time to pay attention is before something forces you to.